Hello friends, welcome back to Complete Medical Coding. Today I'm here with some E&M practice questions, okay, few guidelines which is related to evaluation and management, okay, along with some practice question. Let's discuss it today. Friends, if you are new to the channel, please support me, please subscribe, and let's move to the questions. What is the first question? The first question. Alan, a 42-year-old patient, presented to Dr. Sam's office with complaints of fever, malaise, chills, chest pain, and a severe cough. Dr. Sam took a history, did an examination, and ordered a chest x-ray. After reviewing the x-ray, Dr. Sam admitted Alan to the hospital for treatment of pneumonia. He spent 45 minutes for this service. After his regular office hours, Dr. Sam visited Alan in the hospital where he dictated decision making of moderate complexity. How would you report Dr. Sam's services? Okay. So here, since the initial office visit, what is done here? The initial office visit, it was an initial office visit, right? Dr. Sam took a history examination and ordered a chest x-ray. So initially it was a hospital visit. But then later, after reviewing the x-ray report, the doctor admitted the patient to the hospital. So it means the outpatient is being transferred to admission, inpatient. So in such cases, you have to always code inpatient only. Don't go for the outpatient code. Don't go for the OP code. Okay. If the OP is transferred to IP, you have to always code inpatient. You have to always code the admission only. Okay. So let's find out the answer. And here decision making is of moderate complexity. Anyway, let's find out the answer. Let's go to the codes. What are the codes given in the options? There is 99222 and there is 99204. Only two codes are present from among all the options. 99222 and 99204. Let's check what it is. What is 99204? If you check 99204, that is office visit code. 99204 is an office or other outpatient visit code. But as I told you, since outpatient is transferred to inpatient, you have to code only the inpatient. See, if you see in option B, there is OP code 99204 and what is 99222? 99222 is initial hospital care. Okay, 99222 is initial hospital care code. So, you should not code like this. Anyway, as in the question, initially it was an OP visit, then it is transferred to IP. So, you are thinking that, okay, initially it is, since it is hospital visit, we can code for OP. Then, since it is transferred to IP, then again IP. No, that is very wrong. If, okay, for all E&M queries, for all E&M questions, if an outpatient is being transferred to inpatient, you have to code only the inpatient. Don't code the outpatient. So, in that case, all the options, option B, C and D are wrong because there is OP codes in all the three options. So, which makes the correct answer as option A, 99222. 99222 is initial hospital care with comprehensive history, examination and medical decision making of moderate complexity. Okay. Now, another guideline, you should never use a modifier 51 with E&M codes. See, in option B, on the same code 99222, you can see it is appended with a modifier 51. You should never use modifier 51 with E&M codes. Okay. In any E&M codes, if there is 51 modifier, you can immediately skip that option. It is not applicable. It is not right. Okay. So, that's it. Now, second question. A neonatologist admitting a 20-day-old infant to an ICU for cyanosis and rapid breathing. He performed intubation, ventilation management, and a complete echocardiogram in the ICU and provided a report for the echocardiography which did indicate congenital heart disease. Select the correct codes for the physician service. So what is performed here? A neonatologist has admitted 20-day infant, 20-day-old infant to the NICU. Okay, for cyanosis and rapid breathing. Yeah, what is performed here? What is done here? Intubation, ventilation management, and echocardiogram in the NICU. All these three were performed and then provided a report for echocardiography. Yeah, so let's find out the codes. Moving to the options. What is 99468? Go to 99468. So here you have to code for the echo, of course, echocardiogram. Then intubation and ventilation management. Everything you have to code. Let's find out what will be the exact code. What is 99468? 99468 is initial inpatient neonatal critical care. Yes, this is NICU. Patient has admitted in NICU. 20-day-old patient admitted in NICU. So it means it's a neonatal inpatient critical care, right? So initial inpatient critical care per day for the evaluation and management of a critically ill neonate, 28 days of age or younger. Yeah, this is 20 days. So younger. So this code should be accurate here. Okay. And it is appended with modifier 25. What is modifier 25? Modifier 25 is a significantly identifiable E&M service provided by the same physician on the same day as another procedure or service. Why it is mentioned as another procedure? Why we appended modifier 25? Because there is another echocardiography is also carried out here. Echocardiography, ventilation management, intubation, everything is carried out. Along with the NICU, he did echocardiography also, additional procedure. So you cannot say additional procedure. What do you call it? Separately identifiable E&M service. Okay. Anyway, what is the second code? 93303. That is the code for echocardiogram. Okay, 93303 is the code for echocardiogram. Appended it with a modifier 26, which is professional component because the doctor itself had done the procedure ECG. So appending it with a modifier 26. Alright, that is first option. Now, if you go to option B, 99460. What is 99460? Check if that critical care code is correct or not. If no, then you don't have to search for the other codes in the same option. Okay. So what is 99460? So check 99460. Initial hospital or birthing center care per day. This is not birthing center code. You have to code for the NICU. So that is wrong. Now what is 99471? 99471 is initial inpatient pediatric critical care per day for the evaluation and management of a critically ill infant, 29 days through 24 months of age. So from 29 days till to second year, 2 years of age. This is 20 days, so that is also wrong code. Now 99291. What is 99291? That is also another code for critically ill patient, but that is not for infant. Critical care, yeah, 99291 is critical care E&M code. That is also wrong because we have an exact code which is critically ill, neonatal critical ill inpatient code. That is 99468. So which makes the answer as option A. Okay, 99468. Append it with modifier 25 because for the same, yeah, what is that? Separately identifiable E&M service. Okay, and 93303 for the ECG. Since the doctor itself has done the procedure, append it with modifier 26. Alright. Now third question. An infant is born 6 weeks premature and the pediatrician in attendance intubates the child and administers surfactant in the ET tube while waiting in the emergency room for the air ambulance. During the 45 minutes wait, he continues to bag the critically ill patient on 100% oxygen while monitoring VS, ECG, pulse oximetry and temperature. The infant is in a warming unit and an umbilical vein line was placed for fluids and in care of emergent need for medications. How will you code this scenario? So here the patient is in an emergency. 6 weeks, the infant is born 6 weeks premature. So 6 weeks prior the infant is born means already 6 weeks premature. And then pediatrician immediately intubates the child, administers surfactant, everything he did. He had spent 45 minutes. Okay, then continues to monitor the patient, giving oxygen, pulsimetry, temperature, everything. So all that you have to code. Anyway, moving to the codes. First one, 99291. As I had already mentioned in the previous question, 99291 is critically ill patient. Yes, this is critically ill patient. Okay, critical care evaluation and management or critically ill patient, injured patient, first 30 to 74 minutes. Since here it is mentioned 45 minutes, this code comes in that 45 minutes because this is up to 74 minutes. Okay. Now, it is submitted with the modifier 25, same as I told you because multiple procedures. 25 is not modifier for multiple procedure, but is a separately identifiable E&M code because there are many procedures carried out here on the same date of service by the same physician. So what is, let's code the other procedures also. What is 31500? What is 31500? Just check what is 31500. 31500 is the code for 31500 because the doctor had done ECG, pulse oximetry, everything. So 31500 is intubation. Yeah, intubation is also done, right? By intubating, see during the 45 minutes wait, he continues to bag the critically ill patient. He continues to intubate. It's already mentioned in the first sentence. Intubates the child and administered surfactant. So intubation you have to code. So 31500 is the code for intubation. Intubation endotracheal emergency procedure. Now what is 36510? 36510. 36510 is catheterization of umbilical vein for diagnosis or therapy newborn. Yeah. See here, the infant is in a warming unit and an umbilical vein line was placed. It is mentioned in the second last sentence. Right? The infant is in a warming unit and an umbilical vein line was placed for fluids and in care of emergent need for medication. So, that also you need to code catheterization of umbilical vein. So, that is 36510. Okay. Alright. Now, what is the last code? 94610. What is 94610? Just check what is 94610. Intrapulmonary surfactant administration. Yeah, that is also mentioned, right? Intubates a child and administered surfactant in the ET tube. So, intrapulmonary surfactant administration through endotracheal tube. It is mentioned in the first sentence. An infant is born 6 weeks premature and the pediatrician in attendance intubates the child. So, you have to code for the intubation. Administered surfactant in the endotracheal tube. So, that also you have to code, right? So, those two codes we have marked 31500, 94610. Now, and then at the end it is mentioned the infant is in a warming unit and umbilical vein line was placed. So, that is catheterization of umbilical vein. That is 36510. Okay, and since it's a critically ill patient, code that critically ill code 99291. All these. Actually, option A is the correct answer. All you have to code. If you check options B, C, D, option B only the critical code is mentioned. No, that is only the critically that timing. Only at that timing which is mentioned. For that we are using that critically ill code. So along with that, if there is additional procedures carried out, you have to mark that. And what is option C? 99471. What is 99471? 99471 is what is 99471? Again, inpatient neonatal pediatric critical care. Neonatal and pediatric critical care. But this is a critical care. We already have critical care code 99291. So 99471 is also wrong. Alright. So you have to go for the option A 99291, which is critical care code for the first 70 up to 70 minutes, 34 to 70 minutes. Since our timing in the question is 45 minutes, that marks the exact code of critically ill patient critical care code 99291. Okay. So option A is the answer 99291. It modify 25 for the critical care code, 31500 for the intubation. Then along with that administered surfactant code you have to mark 94610 and 36510 for the catheterization of vein line, for the umbilical vein line. Okay. Hope you understood. Any queries, please mark it in the comments. I know it's a little cannot say it is a complicated, but a little confusing. That's it. If you see so many options, it will be little confusing. Anyway, moving to the fourth question. Alright. After moving to a new state, a mother took her 2-year-old daughter to a new pediatric clinic for an annual physical examination. The provider completed an age, gender appropriate history exam and provided anticipatory guidance. He ordered no additional tests or immunizations. What CPT code is reported? The 2-year daughter has been taken to a new pediatric clinic for annual physical examination. So this is a new patient new patient code. You have to mark it. Okay, let's find out the answer. 99391, 99392, 99381 and 99382. Let's find out what it is. If you check options A and B, 99391 and 99392, that is for the established patient code. Same periodic comprehensive preventive medicine code, but it is for established patient code. In our question, it is clearly mentioned that it's a new pediatric clinic. Patient has been taken to a new pediatric clinic. So in that clinic, that patient is new. So options A and B is wrong. So you should quote from option C or D. 99381 or 382. Let's check what it is. That depends on the age. So 99381 is initial. See, this is the new patient code. These are the new patient codes for preventive medicine. Okay. Initial comprehensive preventive medicine. E&M of an individual including age and gender, appropriate history. See, everything is present here. So you don't have to code it separately. Examination, counseling, anticipatory guidance, everything. Okay. New patient, infant, age younger than 1 year. So age younger than 1 year, you have to code 99382. Sorry, 381. And for 99382, early childhood, age 1 through 4 years. So from 1 to 4 years, you have to code 99382. Since in the question it is 2 year, so 99382 is the code which we need. Okay. So the correct answer is option D, 99382. Alright. One more question. Fifth one. A 90-year-old female was admitted this morning from observation status from chest pain to rule out angina. The cardiologist performs a comprehensive history, comprehensive examination and decision making of moderate complexity. Her chest pain has been relieved with the nitroglycerin drip given before admission and she would like to go home. Doctor has written prescription to add to her regimen. He had given her isosorbide and she is tolerating it well. He will go ahead and send her home. We will follow up with her in a week. Patient was admitted and discharged on the same date of service. What CPT code is reported? So here there is so many in-depth details is mentioned. Some story is mentioned, which is not required for us at all. See, if you check the options, only one code is there. So what we have to code it? What we have to code? Comprehensive history. The cardiologist performs comprehensive history, comprehensive examination and decision making of moderate complexity. Anyway, let's start finding out the answer. What is the first one? 99235. 235, 238, 239, 221. These are the codes. Okay. So what is 99235? See here, the 90-year-old patient was admitted from observation status. So the patient was admitted in the observation. So you have to quote for the observation, right? To rule out angina. It is not transmitted to admission or inpatient. This is not converted to inpatient. The patient is in the observation status. So you have to quote the observation code. Okay. So what is the first one? 99235. Same observation in or inpatient hospital care. Okay. Comprehensive history, comprehensive examination, medical decision making of moderate complexity. This is exactly what we need. Comprehensive history, comprehensive examination, and decision making of MDM is of moderate complexity. We check option B. Again 99238. 99238, that is not an observation code, that is a hospital discharge day management. Discharge code, this is. After doing everything, the patient is, they had mentioned the story, the patient wants to go back, so they will be discharging and then they will do follow up, everything is mentioned, but don't be confused with options A and B, whether to code for the discharge code or to code for the observation code. This everything happened on the same date of service. See, that is why it is, that is what it is mentioned on the last line. Patient was admitted and discharged on the same date of service. So admission and discharge is on the same date of service. So in that case, you have to always code for the admission code, the observation code. Don't go for the discharge code, because if it is more than 1 day admission, then you have to code separately for the discharge code also. Okay. So since this is admission and discharge on the same date of service, always code for the admission code. Here the patient was in the observation status, so code always for the observation code, which is 99235. 99238 is the discharge code. 99239 is also discharge code, so that is also wrong. And 99221 is the critical care code, that is also wrong. We have to code for the observation, so which makes the correct answer as option A, 99235. Okay, observation code. Only the question looks little complicated, little big, but if you can understand the guidelines and the proper explanation, what is the description, what is mentioned in the question, then you can easily find the answer. Okay, so that's it for today, friends. If you find this video useful, please like and share it among your friends. Please help those who are going to take examination. So hope you are finding useful for all of my videos, my previous videos as well. So any questions, any queries, please mark in the comments and I'll be replying back to you soon. And stay tuned for more videos. I'll be coming back again with more practice questions in the next episode. And thank you so much, friends. Please subscribe if you are new to the channel. Please. Thank you so much and bye. Take care.